Today, let's read about dentin hypersensitivity, which is a topic of conservative dentistry. Most often, this may be related to dental caries, traumatic injuries, etc., which can be correctly diagnosed and treated successfully. So, the patient complains of sharp pain in response to various stimuli like heat, cold, chemicals, etc. So, it affects usually the adults of the age of 30 to 40 years. Moving on to the definition, it is characterized by short, sharp pain arising from exposed dentin in the response to stimuli, typically thermal, evaporative, tactile, osmotic, or chemical, and which cannot be ascribed to any other form of dental defect or pathology. So usually it is mainly characterized by pain which is sharp and short. So and usually it occurs when the dentin and dentinal tubules are exposed. Okay. So let's see who is more prevalent for dentinal hypersensitivity. So usually it occurs in adults at the age of 30 to 40 years. The areas that are usually affected are the cervical areas of the facial surfaces of the permanent teeth. Suppose if this is the teeth like this, so this is the cervical area. Here usually it gets affected, and usually incisors and molars are more affected than premolars, and there's more prevalence in patients who are undergoing periodontal therapy. And the etiology is of two types. One is enamel loss and another one is cemental loss. So in enamel loss there is occlusal wear, toothbrush abrasion, effraction, dietary erosion, and parafunctional habits. So in occlusal wear is due to the opposite forces, that is called attrition. So the cusp usually it will be weared off. If this is the normal cusp like this, it will be worn off like this small. And toothbrush abrasion is usually due to horizontal brushing techniques. There will be abrasion due to hard brushing and all. So you can see in the cervical area there will be enamel loss, which leads to exposure of dentin. And dietary erosion is due to intake of high acidic food and all. The time the enamel gets porous and there is exposure of the dentin. And in parafunctional habits like bruxism, and cemental loss is usually due to gingival recession, periodontal disease, root planing, and periodontal surgery. Now, when we look into the development, there are two phases. One is lesion localization and lesion initiation. So, the lesion localization requires exposure of the dentin. So, it occurs by gingival recession, abrasion, erosion, etc. Then, lesion initiation, which requires the removal of the cementum or smear layer, which occurs due to abrasive or erosive agents. There are three theories in dentin hypersensitivity. So, the first theory is direct innervation theory, second is odontoblastic deformation theory, which is also called as transducer mechanism, third is hydrodynamic theory, which is the most accepted one. Direct innervation theory, it's the one of the first theories which was proposed. It states that nerve fibers present within the dentinal tubules initiate impulses when they are injured, and this causes dentinal hypersensitivity. This is the odontoblastic process, and here are the nerves surrounding it. So these nerves, when they get stimulated, they send message to the thalamus as a response to injury or any trauma or damage to the dentin. So the nerve fibers present only in the predentin, that is the starting of the dentin, and inner dentinal zones, but they do not extend up to dento-enamel junction and root dentin, because it is the most sensitive area of the dentin. The pain-inducing substance like potassium chloride, acetylcholine, and histamine, when it is applied on the exposure dentin, it fails to elicit painful response. Therefore, this was a drawback of the theory and it was not approved. So the second theory is odontoblastic deformation theory, which states that the odontoblast or their processes are damaged when external stimuli are applied to the exposed dentin. Suppose this is the odontoblast again, okay, and here there are nerve endings, but the receptors are present in the odontoblast. Here odontoblast acts as a receptor, and when there is an damage to the dentin, it sends message to the thalamus again. Okay, then they conduct impulses to nerves in predentin and underlying pulp. And the drawbacks were odontoblastic process extend only partly through dentin and not up to the DEJ. Then odontoblast membrane potential is very low, hence there is less transduction. Then there was no demonstrable neurotransmitters like acetylcholine in the neural transmission of the pulp. Hence, this theory was no longer valid. Now, moving on to the third theory, that is hydrodynamic theory, which was proposed by Brandstrom M. It is the most accepted theory. So, the dentin contains over 30,000 dentinal tubules, which is filled with dentinal fluid, which is an intracellular fluid of the pulpal connective tissue. So, when stimuli is applied on the dentin, there is rapid movement of dentinal fluid towards the pulp and outward. This can cause direct stimulation of low threshold A delta nerve fibers in the pulp or indirect stimulation of A delta nerve fibers in the pulp by displacing the odontoblastic cell bodies. So the teeth with hypersensitivity must have dentinal tubules open at the dentin surface or patent in pulp. Usually how we differentiate with the normal dentin is that the hypersensitivity dentin has greater number and wider diameter of tubules. Clinical features it's usually seen in 30 to 50 years of age, that is in adults, and the pain is short and sharp on stimuli, and it exaggerates when the stimuli is removed, which is a normal response to dentin pulp complex. The clinical symptoms of dentin hypersensitivity are similar to the acute reversible pulpitis. The differential diagnoses are fractured restoration, fractured enamel exposing dentin, dentinal caries, post-restorative sensitivity, cracked tooth syndrome, bleaching sensitivity. So how can we prevent it? By diet counseling, to advise the patient to consume a proper diet, especially regarding the consumption of acid fruits and beverages. We have to advise a correct proper brushing technique in order to prevent the damage of the cervical enamel and supporting tissues. So we have to avoid any iatrogenic damage to the tooth structure. During scaling or root planing, care should be taken during the periodontal procedures. So the last part of the lecture is management. So there are two steps how you can manage dentinal hypersensitivity. The first one is desensitization of the occluding dentinal tubules and desensitization by blocking pulpal sensory nerves. Either we have to block the nerves or we have to occlude the dentinal tubules because it's got exposed and it causes pain. So by desensitization of occluding dentinal tubules, there is one method, that is formation of smear layer over the exposed dentin and use of topical agents to occlude exposed tubules. So the topical dentinal agents are calcium hydroxide paste, calcium phosphate paste, so silver nitrate, strontium chloride, fluorides, varnishes and dental adhesives we can be apply on the exposed dentin to reduce the dentinal hypersensitivity. Then there is placement of restoration like GIC and composite resin, use of laser like carbon dioxide laser or helium neon lasers. Then we can desensitize the nerve by using potassium nitrate toothpaste. That's all for today. Hope you like the video. Thank you.